All right, we're here with Dr. Wood, and we're going to talk about pelvic congestion syndrome.
How you doing? Good afternoon. I'm David Wood.
All right, so what is pelvic congestion syndrome?
Pelvic congestion syndrome is what can be a debilitating chronic pelvic pain condition. Imagine having varicose veins, those same varicose veins you get in your legs. Imagine having those in your pelvis. That's what causes it. It's actually one of the most common causes of chronic pelvic pain. Up to 70% of undiagnosed chronic pelvic pain is due to pelvic congestion. But it's relatively undiagnosed and unrecognized.
So, what are ways that you can treat it?
Well, there are a few ways. They can be these varicose, the conditions caused by the varicose veins in the pelvis, and you can treat them conservatively with hormones, like birth control pills. Unfortunately, that has limited effectiveness, and if you were to stop the pills, if they do give you a little benefit, if you were to stop the birth control pills, they would probably come right back. Pelvic congestion is largely caused by previous pregnancies, so it's most common in women, and especially in women that have had at least one pregnancy. There's something about the pregnancy, either the mechanical forces of having the baby in the stomach that causes stress on the valves of the pelvic veins. And without good working valves, the pelvic veins just become a sump where blood just falls with gravity into the pelvis. And once it's there, you've got high pressure blood in the pelvis that's stretching out all those what used to be tiny veins, tiny normal veins, turns them into big, stretched out, bulging varicose veins. So the condition is caused by damaged valves. It's also the high estrogen levels of pregnancy that can also damage the valves of certain veins in certain people, namely the saphenous vein of the legs, causing leg varicose veins, and the ovarian veins of the abdomen and pelvis.
So, what age is this most common in?
This is usually going to be women that are premenopausal but have had pregnancies. So we're usually going to see this in women from 25 to 50 years old.
Okay. So when you take them to get treatment, what is the regular treatment that you do for that?
So what I do is once you've decided that you need a treatment that's not the conservative medical treatments that we talked about, then you go to the next step. You go to someone like me. I'm a blood vessel doctor, so I do procedures in abnormal blood vessels all over the body, including the abnormal ovarian veins. So what I do is imagine a spaghetti noodle that's hollow, and I thread it into the big vein at the top of the leg, and then I steer it. I can steer this spaghetti noodle over to the abnormal ovarian vein and ultimately into those pelvic varicose veins. Once there, I inject a sclerosant foam that kills the lining of those veins and makes them shrivel up and disappear. Once we do that, we have to eliminate the source. And the source is usually those ovarian veins that have damaged valves. We have to close that. So I use little metal coils to close the vein. Once the vein is closed, it doesn't come back, and the condition's solved. So this is about a 1 hour minor procedure. The patient is asleep, but just sedated, still breathing on their own. It's not anesthesia. This is not done in a hospital. These are done in outpatient centers. The patient goes home after a brief observation period. The side effects are minimal to none. Back to normal activity the next day.
Is there much pain with this procedure, like afterwards?
That's a good question, and there can be a little bit of sting when we inject the sclerosant foam, but it goes away right away, and there's no lingering pain the next day. So there can be a little soreness and even a bruise at the spot where we enter the vein at the top of the leg, but no pelvic pain. So minimal side effects, and that's good. Back to normal life, no pain meds needed the next day, back to work or back to normal activity the next day. It's nice.
Awesome. Anything else you want to add?
I think that's it. If a patient who thinks that she might have pelvic congestion syndrome should go to their gynecologist and ultimately get an ultrasound. It's the ultrasound, especially a transvaginal ultrasound that's done of the pelvic organs, can easily identify the big tortuous varicose veins that will be running around the ovaries and uterus. Once that's identified in a patient with chronic pain, they should see a blood vessel doctor like me and talk about the treatment options that are available.
How can people schedule with you?
Well, they can find me by going to our website at ImageMed.clinic or call 480-907-7572.
All right, thank you.
Thank you.